Have you ever written the president before?
I think as a kid I wrote Richard Nixon.
It took losing millions of dollars during the pandemic for this Army veteran to write to the White House again. Brian Williams runs a rural hospital in Kansas. He says his hospital has lost millions, not because of COVID, but because of drug companies. In early July, he sent President Biden a letter out of desperation, calling actions by the country's largest drug companies cowardly, disrespectful, and unconscionable.
I think it's a little bit cowardly then to take advantage and profit. When someone's suffering or someone is not doing well, it's not the time to leverage a position that you may have.
In the middle of the pandemic, the drug companies drastically changed how they honor a federal drug discount program for hospitals and clinics called 340B, a move that affected hospitals in every state, hospitals in many cases overrun with COVID patients.
I think during a global pandemic, I think healthcare workers deserve a little bit more respect than to have resources taken away from a for-profit company that seems to already be doing pretty well. You know, the price-to-earnings ratio of Eli Lilly was pretty strong the day I wrote that. Every one of those companies, I looked them up, and they were not suffering tremendous losses as hospitals were. So that's why I wrote it.
Drug companies that want to be part of Medicare and Medicaid have to be in 340B, which forces those companies to sell drugs at discounts to certain hospitals and clinics that provide care to low-income patients. Here's a hypothetical scenario to explain how it works. A hospital buys a drug at a discounted price, in this example $40. It can then get reimbursed by an insurance company at the normal price, $100. After pharmacy and management fees, that gives the hospital $40 to be used any way it wants. Many hospitals say it helps them offer patients cheaper drugs, while others invest in equipment, clinics, or recruit doctors to rural areas.
Some of these rural health clinics wouldn't exist without the Pharmacy 340B program in rural areas.
Congress created the program in 1992 to get drug companies to offer discounts to certain hospitals so they could stretch government funding. In 2010, the Affordable Care Act expanded it. In the decade since, it's exploded. That's evident when you look at the pharmacies contracted to work with 340B hospitals to dispense the discounted drugs. Our analysis of federal data found the number of active contract pharmacies in this program has skyrocketed from 1,700 nationwide in 2010 to more than 31,000 this year. Some hospitals have hundreds of contract pharmacies each. But in late 2020, many of the largest drug companies told hospitals they could only have one contract pharmacy, a major change, hospitals say, cutting off discounts for most prescriptions. Drug companies claim the program has grown too much, with big hospitals and pharmacy chains taking advantage, and that there aren't enough rules in place to make sure the discounts are actually helping patients.
Are you concerned about the patients, or are you concerned about your company's bottom lines, though?
You know, we're concerned about the patients. We support this program. We want the 340B program to continue. But what we're concerned about is that the program as it exists right now, it allows the hospitals and pharmacies that are currently profiting off of this program to take these drugs that our companies are providing at a discount and resell them at higher prices, leaving patients, even in some cases low-income uninsured patients, paying, being forced to pay a higher amount than what the drug was purchased for.
Part of the pharmaceutical industry's issue is transparency. We looked at the 10 healthcare systems with the most contracted pharmacies according to 2021 federal data. We found they've each added hundreds of contracts since they first started reporting, averaging a 32% increase each year. When we asked them how much money they bring in through 340B and what they use it for, they either provided generic answers, declined to comment, or didn't respond.
Our companies, they provide these discounts, but there's no transparency or data around how the discounts are being used, how the money that's being made off of 340B is being used.
The federal government has told drug companies they can't limit contract pharmacies, But the industry is pushing back in court. Many stakeholders are calling on Congress to clarify the language, to fix everything. But so far, that hasn't happened. While the federal questions linger, low-income patients are losing benefits because of the drug companies' actions. Retired police officer Andrew Kozowski takes medicine for diabetes. The Illinois hospital that treats him passes its 340B discount down to patients through a prescription program. He was able to get his insulin for just $15 until drug companies changed course, pulling discounts from contract pharmacies.
It affected my mind. I didn't have any idea what to do. I didn't know which way to turn. I knew what I was going to have to do is just not to have the medication because I couldn't afford to get the medication. So it was just a flip of the coin, I guess.
Without the hospital's program, his insulin and other medications cost about $2,500 a month out of pocket after his Medicare benefits run out, which is more than his Social Security check.
I want the pharmaceutical companies to know that's what they're doing to countless individuals. They're affecting so many lives, and I want to make sure they understand that.
Ann Webster is his nurse practitioner. She's had many patients like Andrew have to switch to less effective medicines, all again during the pandemic.
They just pulled the rug out. People lost their jobs and they lost medications at an affordable price. It's been detrimental.
Kozowski is now relying on a manufacturer's patient assistance program to get his insulin. Meantime, Brian Williams is still waiting on the federal government to fix this program.
Did you hear back from the president?
No, sir. No. And I'm sure he's busy.
He says he's worried about what will happen if Congress doesn't step in to the discount drug war and hospitals like his get closer to flatlining.
Without resources, my biggest fear and what keeps me awake at night is how soon does quality get impacted?